All right, let's talk about seizures, a topic that can be super overwhelming. But I promise by the end of this video, you'll understand it like a pro. We're breaking it down in simple, easy to remember ways with some fun memory tricks. Plus, we'll go over the types of seizures, what to do during an episode, medications, triggers, and nursing care. So grab your notes because this is going to be quick, easy, and unforgettable. Okay, let's start with the basics. What exactly is a seizure? Think of your brain as an electrical circuit. Now, imagine if someone just cranked up the voltage and everything went haywire. That's a seizure. It's basically uncontrolled electrical activity in the brain that causes sudden changes in movement, behavior, awareness, or sensation. Seizure as brain power surge. And here's the thing, seizures are not a disease. They are a symptom of something else going on, like epilepsy, head trauma, infections, or even low blood sugar. Seizures, symptom, not a disease. Memory trick, the shocking brain. Here's an easy way to never forget seizures. Just picture a brain getting zapped like a lightning bolt. The stormy electricity overloads the brain, causing all these weird symptoms like shaking, twitching, staring spells, or sudden collapses. Seizure, electrical storm in the brain. Types of seizures, know the difference. Now, not all seizures look the same. There are two major categories you need to know: focal and generalized seizures. Let's break them down super fast. Focal, partial seizures, localized to one part of the brain. Simple focal, person is awake but might have twitching or unusual sensations. Complex focal, person is confused or unaware, may smack lips, pick at clothes, or stare into space. Focal seizures are like glitches in one part of the brain. The person might not pass out, but they might act strangely for a few seconds to minutes. Generalized seizures. Both sides of the brain are affected. Tonic-clonic, grand mal, the big one. Full body stiffening, tonic, plus jerking, clonic. Patient loses consciousness and might even bite their tongue. Absence seizures, petit mal, daydreaming seizures. Person stares into space for a few seconds. Myoclonic seizures, quick jerky movements like getting zapped. Atonic seizures, drop attack. Person suddenly collapses because their muscles lose control. The tonic-clonic is the one you see in movies where the person shakes and falls. But absent seizures are sneaky. They look like daydreaming. Common seizure triggers. Flashing lights, hello, strobe lights at concerts. Lack of sleep, your brain needs rest. Stress and anxiety, too much adrenaline overloads the brain. Low blood sugar, hypoglycemia are brain freakout. Missed meds, biggest cause of breakthrough seizures. Alcohol or drug withdrawal, brain overreacts to sudden changes. Yup, flashing lights can trigger seizures, but so can things like stress, dehydration, and even skipping meals. If you have epilepsy, avoiding triggers is key. What to do during a seizure, nursing, and first aid. All right, nurses, this part is critical. What do we do if a patient is actively seizing? Here's your seizure action plan. Stay with the person, do not leave them alone. Protect their head, use a pillow or soft object. Turn them on their side, prevents choking on saliva or vomit. Time the seizure. If it lasts over 5 minutes, call 911. Loosen tight clothing so they can breathe. What not to do? Do not put anything in their mouth. No spoons, no fingers, nothing. Do not restrain them. Let the seizure run its course. Do not panic. Stay calm and follow protocol. If a seizure lasts longer than 5 minutes, or if the person has back-to-back seizures, that's called status epilepticus, and it's an emergency. Common anti-seizure medications. Phenytoin, Dilantin, blocks sodium channels, carbamazepine, Tigretol, mood stabilizer, plus seizure control valproic acid, Depakote, used for epilepsy and migraines, lorazepam, Ativan, and diazepam, Valium, used for status epilepticus. If a patient is having constant seizures, we grab Ativan or Valium to calm their brain down fast. Nursing considerations, what you need to know. Monitor medication levels. Phenytoin toxicity is bad. Educate on seizure safety. No swimming alone, no heavy machinery. Encourage a seizure diary. Track triggers and med effectiveness. Always have rescue meds ready. And if your patient is on seizure meds, always check their liver and kidney function, because some of these meds can be tough on the body. Boom! You just mastered seizures in under 10 minutes. Now you know the types, triggers, first aid, meds, and nursing care. If this helped, don't forget to like and subscribe for more easy med breakdowns. See you next time.